So, hello, this is Dr. Amy, your friendly rheumatologist from Onabridge MD. Okay, so today we're talking about Plaquenil because I've realized that I use it a lot, and you're going to see why. And a lot of my patients have no clue what it is. And I thought, okay, let me talk to you. You may have heard about it because during COVID-19 pandemic, there was at a moment where we thought that maybe it could help. It showed that it does not help, but it definitely helps our patient with rheumatologic condition. So the first thing we're going to talk is what it is. The second is how you take it and why you want to take it. And then finally, we'll talk about some of the complication and side effects associated with it, which you're going to see are pretty rare. So the first thing is it's a history thing. Um, Plaquenil is actually an anti-malarial. So it's an anti-malarial treatment and prevention, which actually nowadays doesn't work anymore. So we don't actually use it anymore for malaria. But that is the reason it was started. And I find it always funny. So when you know that it's an anti-malarial treatment, you then know that it's probably not immunosuppressive. And it is the case. It is not immunosuppressive. It does not decrease your immune system. Rather, what it does is that it rebalances your immune cells. So I'm not going to go into the details, but basically at the cellular level, it changes the pH, so the acidity of the cell, and doing so, somehow, and we don't actually know really exactly how, but it rebalances our immune system, but not immunosuppressive, which is wonderful. It takes a very long time to work. So you should not expect improvement of your symptoms after like a couple of days. It's just not going to happen. It takes up to 4 months to work. So you are committed yourself to take at least 4 months to decide if this is working or not working. And I usually tell my patients, like, just give it some time, take it, and then see how it goes. And maybe put all of your symptoms in a journal and look 4 months later. You can look maybe every month and see how it is, but it's going to take up to 4 months. So why we like it? So we like it, one, because it does work in rheumatologic conditions such as rheumatoid arthritis, lupus, autoimmune conditions such as um, uh, undifferentiated connective tissue disorder or mixed connective tissue disorder. So basically, in a way, you could almost argue that anything with a positive ANA, it probably helps. And then in rheumatoid arthritis, it does help. I would say that it doesn't usually is enough in its own to really get you to full remission, but it does help, and we do have some patients where it helps and it's enough. Um, so that's the first thing. We love it in lupus because it prevents flare. And as you may know, having a flare when you have lupus is a problem because it can actually cause issues with your kidneys. And we don't want that because every time you have an issue with your kidneys, it's harder to get back to a full function of your kidney. So we do love it for patients with lupus, and we do love it for people who have other conditions where immunosuppression is not recommended. All right. Now, what are the things that you have to know before you start it so that you know in advance that, hey, if this were to happen to me when I'm on Plaquenil, I need to stop it. So the first thing is that the main side effect, there are very little, really, honestly, but the main side effect is maybe a little bit of nausea and a little bit of vomiting if you're really sensitive. But honestly, it goes with time. And what I usually tell my patient is take only one tablet per day for a week and see how you're doing. And then go up to the full 2 tablets per day. Most of the patients have a weight that's over 70 kilograms. And so you are going to need most likely 2 tablets per day. And you can take them together or you can space them morning and night. But yeah, 2 tablets per day and then start at one. The second thing is that, and that is most likely for the woman, is that after many years, you can actually have deposit on your skin and it causes like a bronze look. And usually, honestly, if it were me, I'm vain and I would not want to have it because it's not a bronze of all of your body, like homogeneous, but it's like patchy, like, maybe just the hands, maybe just the face. And so It's not really something that's very good looking. However, it takes a very long time for it to appear. And usually you're going to have maybe one area. And so we can stop it. And then usually it comes after time, it goes back to normal. Uh, it's funny that I'm sharing this side effect, which is one, very rare, and two, it's really just cosmetic. But we women care. The first side effect, which you have to know, is an anemia. It's very rare, but in patients who have what we call G6PD deficiency, it can cause anemia. In general, we see this, we can actually predict it. I don't personally check G6PD deficiency in all of my patients, just because I actually do blood work more often than not. And so I just feel like I'm going to see that there is an anemia. Anemia, if like, we will see that. But some people, they do like to check G6PD. There was an ant coming on me. The other one is that there are so this is actually the one that is um, the most concerning side effect, super, super rare, but something that you need to know because we're going to ask you to do an eye exam every year. And I want you to understand why we're doing this. So, in very rare cases, after more than 5 years of being on this drug, because it's a cumulative drug, there can be something called retinopathy. So, retina is it's the screen behind your eye, where basically when you look at something, there's a signal to your eye and it goes into the retina. So, it's really the screen, right? Like when you're looking at a movie going to a screen, that's the retina. The screen is the retina, but you need the screen to see. And so what's happening is that with the Plaquenil, with time, again, in very rare instances, there can be deposit on the retina that can lead to retinopathy, which is pathology of the retina or disease of the retina. And that can lead to, if you don't take care of it, like full blindness. I want to reassure you, you're not going to get there because your rheumatologist is going to ask you to do an eye exam once a year. The truth, you probably don't need an eye exam once a year for the first 5 years, but we usually do it just so that you get into this habit of doing an eye exam once a year. Personally, I don't want to have any of my patients develop a retinopathy. The eye exam can see any sign of retinopathy way before it causes any issues in your eye and that you would actually realize anything. And so for that reason, we just get to have you do an eye exam once a year. All right. So that is very rare, but it is why we ask you to do an eye exam once a year. Otherwise, I personally don't refill the Plaquenil, or I refill it for like 1 month and I'm like, no, you have to do your eye exam. That's what it is. Overall, a very well tolerated drug, very easy to take. It's oral, doesn't really need any blood work afterwards. So, maybe I usually do blood work once a year in my patients who are in full remission and are just on Plaquenil, just to make sure that actually the disease is doing well. And so that's part of the thing. And then one eye exam once a year, which again, honestly, like if you have Sjogren, for example, you want to have an eye exam once a year. So that's it. It's a very good drug. It prevents flares in patients with lupus. I think every single patient with lupus should have Plaquenil unless you have a reason not to have it. So talk to your rheumatologist and other well tolerated. All right, I hope this helped you. If you're looking for a rheumatologist in the Denver area, I'm currently taking new patients. You can contact us at info@onabridgemd.com. And otherwise, like, subscribe, enjoy these videos. I love teaching rheumatology, so I really hope you enjoy it. Take care. Bye bye.